Welcome to Dr. Balga's podcast for the Curious Doc. Today is June 1st, 2026. This video is on an article published in Nature Health, published online today, hot off the press, 1st June 2026, titled Health Effects Associated with Alcohol Consumption, a Burden of Proof Study. It's open access, anybody can access it. The Nature Health 2026 burden of proof study evaluated alcohol and 20 health outcomes. What methods did they use? 16 systematic reviews across PubMed, Embase, CINAHL, and Web of Science. They studied 843 cohort and case control studies between 1961 to 2023. Outcomes were 10 cancers, 4 cardiovascular diseases, and 6 other diseases. They utilized meta-regression Bayesian, regularized, trimmed, or also known as MRBRT framework, with bias adjustment, heterogeneity modeling, publication bias assessment, and burden of proof risk functions. What did they find? Alcohol increased the risk of breast, colorectal, esophageal, laryngeal, lip, oral, pharyngeal, liver, pancreatic, prostate, and stomach cancers. Strongest association, other pharyngeal cancers, relative risk 4.24, conservative risk increase 105%. Cirrhosis and chronic liver disease, relative risk 4.25, pancreatitis, relative risk 2.65. The J or U-shaped relationships for type 2 diabetes, dementia, ischemic heart disease, ischemic stroke, and hemorrhagic stroke. Even low alcohol intake was associated with increased risk for several cancers. What are the limitations of the study? Observational data, residual confounding, self-reported alcohol exposure, no beverage type or binge drinking analyses. There were no randomized long-term trials. Key takeaway: high alcohol intake increased risk across all outcomes. Cancer risk increased even at low consumption levels. The apparent cardiometabolic benefits remain uncertain and observational. Clinical pearls: alcohol is a group 1 carcinogen. The risk rises progressively for multiple cancers. There is no universally safe alcohol threshold. Low to moderate intake showed possible reductions in type 2 diabetes, dementia, and some cardiovascular outcomes, but evidence was weak and potentially confounded. Atrial fibrillation risk increased with alcohol exposure. Cirrhosis, chronic liver disease, and pancreatitis demonstrated strong dose-response relationships. Counseling should emphasize overall risk, not only cardiovascular outcomes. Public health messaging should highlight cancer risk even at low levels of consumption. Younger individuals derive little potential benefit and face measurable cancer risks. Heavy episodic drinking should be discouraged. Shared decision making should individualize discussions of alcohol use. This is an infographic of this paper. Hit pause and read at your leisure. Podcast brought to you by masterbedfacts.com. This podcast is for physicians and healthcare providers. If you enjoyed this video, please like, subscribe, and forward to your friends.